The Pharmacy on Today, sponsored by Boots.
Now, with the colder weather creeping in on us, illnesses such as the common cold and the winter flu would be making a comeback.
Taking care of our immune system is more important than ever, and live in our Dublin studio we have pharmacist Heather Feedy. Heather, always great to have you on the show. Heather, what can we do to avoid coughs and colds this winter?
We're actually already doing a lot of the stuff we should be doing in light of COVID-19. So we're doing a lot of the great things right now. So it's the same as you have for COVID-19. It's your hand washing, hand hygiene, good cough etiquette, maintaining kind of smaller social groups and obviously staying away from anyone who's feeling under the weather. And then obviously there's a kind of normal health advice that we have around this time of year. So things like having a really good nutritional balanced diet, exercise, taking care of your sleep. So I suppose there's the piece that's taking care of yourself, and there's also these new good habits that we've learned in this the context of a pandemic.
It's interesting actually that you say that, because I would reckon that maybe less people will get colds and flus and snivels this year because of social distancing. But I suppose it is important to give your immune system a boost, maybe with vitamins if you don't have a good diet at this time of the year.
Yeah, so you do generally get most of the vitamins you need from your diet, but it is possible to supplement if there's any areas you feel you might be lacking. So a few good kind of vitamins to support during these times will be the likes of your B vitamins. So those are really associated with things like your energy levels, and they're also part of like the general production and maintenance of a lot of your bodily cells. So vitamin B is always really good. You'll know that C is really associated with immunity, and that's also associated with things like your connective tissue maintenance. So like healthy gums, healthy tissue in the body, and that all kind of, I suppose, paints the wider picture of having a healthy body and keeping you well over the winter. And then obviously zinc is always really important. So zinc is very much involved in cell maintenance and production as well, and you get that from a lot of nice fancy foods like shellfish and oysters, so you can also enjoy it. But yeah, it's really important to kind of be staying on top of yourself nutritionally this winter, because no one wants to be getting sick, especially in the current climate.
Heather, what about if you're like myself and Maura, who are inside for a lot of the day and we don't get as much sun? What about vitamin A and D?
Yeah, D, you'd know, is the sunshine vitamin, and we certainly don't get enough of that in Ireland. We haven't had a lot of sunshine, and it's not something that is naturally occurring within the diet. So you'll see that a lot of products are fortified with vitamin D, a lot of milk products and things like that. You also get it from eggs, and vitamin D certainly is very important to kind of support with immunity and wellness through this winter season. It also helps absorb calcium from the blood, so really important for keeping the bones healthy as well. It'd obviously also be really important to be exercising at these times, so making sure you're getting out, going for walks, and kind of, I suppose, maintaining really good respiratory function. So doing a bit of exercise to maintain that, because a lot of the kind of colds and flus that circulate, they really affect the respiratory system. So very important to be doing that exercise and having that varied diet as well, that you can supplement when needed.
It's hard to get out there more, isn't it?
It is. I suppose we've had that kind of sunny cold at the moment, that's easier. But it's interesting what you say there, because a lot of people that maybe suffer from respiratory issues would almost shy away from exercise. But physical exercise is really important. Does that actually strengthen the muscles in our chest? And I suppose when you think about our lungs, does it give us the ability to breathe better if you're fitter?
Certainly, so exercise is obviously associated with things like maintaining a healthy body, and anything that kind of, I suppose, supports the body does support respiratory function. So if you're not exercising, the chance is, you could be carrying a few extra pounds that you don't want to be. You're not getting kind of natural oxygen occurring through exercise during the day. So really important to go out and exercise. And certainly there are people with certain chronic conditions who might find that a little bit more difficult. But exercise can be as simple as a brisk walk, or right now it's 5 kilometres around the house, so wherever that brings you. But yeah, it doesn't have to be necessarily overly strenuous, but still, any sort of walking, physical activity does really support your body.
Heather, what about people who would have a poor immune system? What should they do? Should they up the dose or what?
So it depends on the reason why they would have a poor immune system. So some people might have a reduced kind of immune function due to treatment they're undergoing. So that would be someone who's undergoing something like chemotherapy, or there can be various treatments for things like rheumatoid arthritis, and they would always be under the supervision of a consultant and a GP and a pharmacy, all supporting their care plan. But general advice, if you do have a weakened immune system, or if you're feeling a little low in yourself, would be to just take a little bit of extra care with yourself. So make sure that you're really maintaining a nutritionally balanced diet, get adequate sleep, because sleep is very important, the maintenance of a normal functioning body, and then in addition to that, looking at those vitamins that support immunity and making sure that they're either being captured within your diet, or else you can chat to your pharmacist around supplementation that might be suitable for you.
Heather, of course, it is the time of the year that people consider getting the flu jab. Do you think it's even more important this year to avail of that?
Yeah, so the flu vaccine is the best way to prevent you from getting the flu. And given the current context, none of us want to be going to hospital, none of us want to be going to the GP necessarily where we can avoid it. So getting the flu vaccine is very important. Now, certainly we have seen unprecedented levels of demand for the flu vaccine this year, which is excellent, and that's going to help public health as a whole. But absolutely would certainly recommend getting the flu vaccine.
Yeah, and it was reported a few weeks ago that there was a shortage. Has that changed, Heather?
Yeah, so I suppose the situation is that we are seeing unprecedented demand, and the HSE are who provide the flu vaccine to your pharmacists and your GPs who provide it then on to the public. So certainly there have been some difficulties in terms of supply this year. There's obviously massive worldwide demand for the same vaccine, so it has been challenging, but there are certain groups who will be particularly high priority, and that would be like your individuals who are over 65 with chronic health conditions, or those who are in contact, like maybe a carer or a doctor or a nurse, but who have direct contact with patients, so really important that they would stay well. And with those groups, I would encourage them still to reach out to their GP, to their pharmacy, because while there have been supply issues, we will do everything we can to get you a flu vaccine. So I know certainly in the pharmacy that we work in, we operate a waiting list. So I'd give them a call and still get myself on the waiting list despite supply issues.
And you're right, actually, it's probably the time to give somebody a call. But also, of course, we see the flu vaccine for us, which we can get in pharmacies and from our GP. But for children this year as well, between the ages of 2 and 12, it's free from your GP. And that's a nasal spray.
That's great, isn't it?
It's a good idea.
Yeah, it's excellent. It's free from your GP or pharmacy for people aged 2 to 12, and it's a nasal spray that's administered up both nostrils, and I've done a few myself. They're fine, and kids find them quite tolerable. So yeah, seeing a big uptake, and that's really going to help with the circulation of flu to stop that spread this year.
Heather, if you are taking vitamins, right, I've always wondered, how long does it take for them to kick in?
It depends based on the type of vitamin that it is, but generally what we would say is, it's probably quite broadly speaking, but after maybe 2 to 4 weeks, you should feel some sort of effect from the vitamin. Now, there certainly are other kind of vitamins that you'll see are fortified with different things. So a lot of your energy vitamins, they can be fortified with a little bit of caffeine and things like that. So you'll certainly feel them straight away. But the actual kind of benefits of vitamins, you'd be looking at maybe 2 to 4 weeks, Dahi.
So there's no kind of overnight.
There's no, it does, and it's true actually, because even people who say suffer with arthritis or joint pain, a lot of people like that say may supplement with fish oils. It does literally take about 2 or 3 weeks, as Heather says. Heather, thanks so much as always for joining us. And of course, if you have any health concerns, do consult your GP or your pharmacist. And if you want more information, which should say on today's topic, head over to our Facebook page, which is RTE Today.
The Pharmacy on Today, sponsored by Boots.